I'm Dr. Gary Clayman of the Clayman Thyroid Cancer Center of Tampa, Florida. In this video, we're going to talk about what about my voice in thyroid surgery?
Yeah, thank you, Dr. Clayman. I think that one of the biggest fears for everybody undergoing thyroid surgery, whether it's thyroid surgery for a goiter or for a nodule or for thyroid cancer, the biggest fear I think everybody is losing their voice and they can't talk because some of us, I know somebody who can't talk for the same reason, and all over the internet, people, horror stories. Tell me about that. We're all afraid of that. So am I going to lose my voice after this thyroid surgery?
You shouldn't lose your voice after thyroid surgery. Now, you may be a little bit hoarse after thyroid surgery. Sometimes even when I just beautifully save a nerve, identify the nerve, and do the surgery.
The vocal cord nerve.
The vocal cord nerve. It can become temporarily dysfunctioning. That's not common, but it can. So you can be a little bit hoarse after surgery, but you should not lose your voice after thyroid surgery.
Then why are there's people, I know people who can't talk after thyroid surgery. What happened to them?
Yeah. So sometimes it's because of just a temporary injury to the nerves, to the voice box. But sometimes it's due to an inadvertent injury, which is known or not known. So the nerve is cut.
You mean during the operation, the surgeon is injured, he's burned it or lasered it or cauterized it or cut it or put a clip on it.
Something's happened to the
to
nerve.
a vocal cord nerve. And there's a vocal cord nerve on both sides of the neck.
Right. And if both are permanently injured, both are permanently cut or burned or somehow injured in the process, that is absolutely devastating.
You could need a tracheostomy to breathe even, right? Yeah, so we're freaked out about this, and in fact I'm getting even more freaked out by doing this video because I can hear all these bad things because you say it shouldn't be happening, but it does happen. Is it happening because of inexperience of the surgeons? Clearly, I've been reading the literature online, and clearly the surgeons with the most experience have the lowest complication rate of
Absolutely.
That's true, right? So that's really an important question I have to ask my surgeon is, A, how often does this happen to you? And B, how often do you do this operation? Is that right?
That's right. That's right. And there's, I'm sure you've heard about nerve monitoring. It doesn't prevent this from happening. What prevents this from happening is your surgeon seeing the nerve and saving the nerves.
Right. I've read articles about nerve monitoring actually make things worse because the surgeons...
A false sense of security.
The surgeons think that they're protected because of the nerve monitor, but in fact the nerve monitor just isn't set up correctly and it's not working. So whether or not my vocal cord gets injured has nothing to do with whether I'm getting my nerve monitored. It has everything to do with the experience of my surgeon. Is that what I'm taking away?
In fact, nerve monitoring only tests the ability of the nerve to function. It doesn't prevent it from getting cut.
Exactly. So most of the time though, I should if I pick the surgeon who's really good at this stuff, my expectation is I should not have a vocal cord injury. It should be way less than 1%. And if my surgeon can't tell me that it's way less than 1%, then I'm getting up and going somewhere else.
Find somebody else.